Hello and good morning, everyone. Thank you so much for attending. We're here today to discuss changes to the fiscal year 26-27 employee benefits. We're happy to welcome Lori and Tom Braceland here from Millennium Insurance Group. They are our insurance brokers. A couple items of housekeeping. Over on the table here, there are booklets and information that Lori's going to be covering. If you'd like to pick one up and kind of follow along, you're welcome. Or if you would like to grab one on your way out, please do so. Also in the lobby area, there are refreshments. Lori and Tom brought cake, which is very delicious. If you've been here in years prior, you know that it's very good. There's also some coffee. Again, Lori will be covering plan design changes, general questions. If you have like Q&A, if you have some specific questions for your own account, you're welcome to sidebar with Lori and Tom at the end. And otherwise, I will kick it over to Lori. Thank you.
Thank you. When does your open enrollment end?
The 3rd, June 3rd.
Okay. Good morning, everybody. It was a rainy drive. We're in Pennsylvania, so it was a rainy drive getting here. It was a downpour down 81. So looks like it's finally clearing off. So hopefully we'll have a sunny day. As Jessica said, the purpose of today is to go over changes and some general information to your employee benefits packet. You should have gotten handouts from my husband that has the Highmark book, along with some of the other highlights. These changes take effect July 1st. Your deductible, however, runs on a calendar year. So your deductible will reset January 1, just so that we're clear on that. First thing I'm going to talk about is, of course, the medical plan. I'm happy to say that we are remaining with Highmark for another year this year. We did look at a number of options. I can tell you that the initial renewal came in and it was a pretty substantial increase. So having said that, we did need to make some plan design changes, but I think you're going to find what we did impacts the least amount of people. And the good news is we were able to keep your health contributions this year exactly the same. So whatever you're paying currently, that's what you will be paying effective July 1, unless you change your tier of coverage for some reason. This is open enrollment, so whatever you decide now will be for the year, July 1 through June 30th, 2027. Bear in mind, if you have a qualifying event throughout the year, your spouse loses coverage, you need to add somebody on your plan, you have the birth of a child, you can make those changes. You have 30 days from the date of a qualifying event to make the change. And I stress this because if you have a baby during that time period, you have 30 days. If it goes beyond that 30 days, Highmark can decline to add that dependent. So when in doubt, make sure you check with Jessica. This year, as we did last year, we're going to be handling open enrollment through Bernie Portal. And this is what you used last year. It is a portal set up specifically for Jefferson County. If you don't remember how you logged on, we do have a sheet up here. There's a code that you would put in. Your employer code is 80157 small a. And then if you've done this last year, you should have a password set up. If you forgot your password, you can create a new password, but you can go online there and look at what your current elections are. It's also going to show you the new plans, the rates, everything associated with your benefits package is on that portal. That portal is also available to you throughout the year. If you're at a doctor's office and you don't have your ID card, you can pull up on your phone, Bernie Portal at any time, get your group number, your co-pays. If you want to see a directory of dental or medical providers, everything is listed on that portal. So we would encourage you to use that more than just open enrollment. As of this morning, we've only had 7 people in Jefferson County go on the portal and complete their open enrollment. If you're not making any changes for the year, Jessica has a form you can sign, and it'll automatically roll you over for the next policy year effective July 1. Bear in mind that whatever coverage you elect for yourself on the medical, maybe you only have yourself on medical, but you want to put you and your family on dental and maybe just yourself on vision. All of those coverages are standalone coverages. So what you elect for on one line of coverage is not necessarily what you have to elect on the other lines of coverage. Again, the Bernie portal login, there's a handout out here, and I know Jessica has them as well if you need to refresh yourself on how that works. Going over the Highmark policy, because that seems to be the first thing that people are interested in. In the booklet, you will find your actual summary of benefits. It's towards the middle. I wish I could say they numbered the pages correctly, but it is in there. It says Jefferson County Commission $7,500 deductible, Super Blue Plus 2010. You're going to notice that the deductible is exactly what it was this previous year. It's $7,500 per individual, $15,000 per family. Now, having said that, you have an HRA that is involved. On the $7,500 deductible for individual coverage, you are only responsible for the first $750 of that. Anything that goes between the $750 and $7,500, the county picks up. Just like we have always done, if you exceed that $750 deductible, you simply take a copy of your explanation of benefits, you attach it to a claim form, and you send it to Millennium. We look at it, make sure that it's applicable, notify the county, and they will reimburse you with a check. Any money that you get back is not taxable. Now, the reimbursement is for deductible only. You will see a handout in there that says HRA in-network medical only deductible reimbursement policy. That is how you get reimbursed for anything beyond the $750 individually or the $1,500 per family. Remember, no one person will ever pay more than $750. So if I have my whole family on the plan, I'm going to pay $750. My family has $750, my spouse and my children. Between the other people on my plan, they make up the other $750. So if my wife had $500, my child had $250, I've now met that other $750 deductible for a family. No one person will ever pay more than $750. The big change that we made this year is on brand and specialty drugs. If you are someone who is on a brand name drug or a specialty drug, these are normally very, very costly drugs. And we know we do have a handful of people that are on these expensive drugs that are running $6,000, $7,000 a month. We talked about this last year and trying to control these costs because that is what's pushing the loss ratio on your group. So what we did this year is we have made brand name and specialty drugs subject to the $7,500 deductible. So if I'm on a brand name or specialty drug, how is that going to work? Everybody's going to get a debit card from Highmark. That debit card is going to cover you and any dependents you have on the plan. When I go to the pharmacy, if I get a brand name or a specialty drug, they're going to charge me the price of that drug. And I know for some people, it might be $6,000. For others, it might be, $300. You are going to use that HRA debit card for the first $7,500 per individual or $15,000 of drug costs at the point of purchase. So if I go, I'll use CVS as an example. If I go to CVS and I have a brand or a specialty drug, whatever that drug cost is, they're going to charge me for it. I simply give them the debit card. They're going to take the money off the debit card, just like a Visa, and I'm going to leave with my drugs. Once I go through that $7,500 that the county is funding, so they are funding all of these drug costs, I then pay 20% of the specialty and brand name costs up until the maximum out of pocket, which is the $10,600 individually or the $21,200 per family, bearing in mind that that out-of-pocket includes the deductible of $7,500. So that's the big major change this year. For somebody who's on a generic drug, it's not going to affect you at all because generic drugs are not subject to the deductible. You're simply going to pay your generic copay and you're going to leave. This is set up as a mandatory generic plan. So if I go to the pharmacy and I'm getting a brand name drug, but a generic is available, I'm going to pay the cost of the brand name plus the cost differential, the copay plus the cost differential. So if there's a generic available, I'm encouraging you to use that. Yes, sir. It's on the Highmark website. You can see, yeah. And generally, if you Google a drug, it'll tell you right there in GoodRx or anything like that if there's a generic available. Yes, sir. Correct. Now, bear in mind that if you are on a specialty drug and you use up that $7,500 deductible for specialty drugs, you're not going to have the $750 deductible for medical. So they feed one another. Just so we're clear on that. Yes, sir. For your generic drug, you're going to pay your generic copay with your own debit card out of your pocket. If you are getting a brand name drug or a specialty drug, that is the only time that you use the debit card. No, they're not supposed to be able to run the generic on there. It is set up as strictly a brand and specialty drug. Yes, sir. Yes, if it's a brand or specialty drug, yes, on the Trump website. So it will be used just like a credit card that you would enter anyplace else. And that brings up a valid point. I wanted to encourage people to look at the Trump RX website because there's some costly medications that you can get significantly cheaper there. Also, don't ever hesitate to look at GoodRx because there's a lot of times that GoodRx is going to be less than the copay under the Highmark plan. So if you really want to control your costs, look at those options. If you're doing mail order, the debit card, as I said, works like a credit card. So you can put that debit card number on there and it should process through for any brand or specialty drug. Any questions on that? Like I said, that's the biggest change that we have this year. I'm just going to hit on the other changes that we have. Your telemed office copay, we noticed a lot of people are using telemed, which is great. It's a more cost-effective way to see a doctor. The copay used to be $10. We've actually lowered that to $0. So if you're using telemed, it's not going to cost you anything to see a physician. Emergency room copay. bearing in mind that it is waived. If you are admitted to the hospital, it then becomes subject to deductible and coinsurance. You are going to pay a $250 copay anytime you use the emergency room. And then after that, it's subject to the deductible and 20% coinsurance. What we saw a lot of ER visits on your group. I don't know if it's people just not having a primary care physician or what, but we had one family that went 7 times to the emergency room. So what we're trying to urge you to do is to use urgent care or get a primary care doctor. It is significantly cheaper. Bearing in mind, if you are sitting at home and you're having chest pains and you're not sure if it's a heart attack, get to the ER. If it turns out to be nothing, it doesn't matter. We still want you there. If for some reason you go to the emergency room and they code it as non-emergency, even though it was an emergency, that's when you call us at Millennium. We will contact Highmark and we will attempt to get that recoded. So you're simply paying the $250 copay and not paying deductible and coinsurance for non-emergency use of the emergency room. Urgent care, I have to look here at the schedule of benefits. $75. Yep. So it's a lot cheaper, $75 versus $250 to go to the urgent care. The other thing that we changed is outpatient mental health. It used to be subject to deductible and coinsurance. This is mental health and substance abuse. We have changed this, so it is now simply a $25 copay when you go in to see a provider. So if you're accessing that care, it's substantially less costly for you to use that type of care now. Generic drug copay has been reduced from $15 to $10. So if you're on a generic drug, that's the most you will pay. If by chance that generic drug costs $4, you're only going to pay the $4. So that's the maximum cost for generic drugs. So that went down as well. And as I said, the big change was on the brand and specialty drugs. It does say on the handout, this year you have a $250 deductible on brand and specialty drugs that you had to pay first. We wanted to keep that in place. I just found out 2 days ago that Highmark can't handle that behind the scenes with the debit card. So even though it says you have a $250 deductible on brand and specialty, $500 per family, they're going to process it through on the debit card. So it's not something that you're going to actually have to pay this year. So again, that's another benefit, is that deductible went away for that type of medication. Any questions on the changes? Everything else on the plan remains exactly the same. Actually, I think this was a great renewal, because even though we changed how brand and RX are functioning, it's not going to cost you more out of pocket. The county's picking that up. Your contributions are not going up this year, which that's unheard of in this market. We're seeing increases, just trend out of the gate before they look at loss ratio is 12%. That's just the markup coming out of the gate, and then they go from there. As I said, your initial renewal was close to 40%. So we pulled some miracles to get it to where it is this year. Controlling those prescription drug costs is key. So whatever you can do to help manage that, talk to your doctor, look at Trump RX. They have, I think, Eliquis on there you can get for $50. We also are putting information up on your website for Canada meds. You can get some of the drugs out of Canada substantially less than what you can get them here in the US. Now, supposedly this is changing with Trump's negotiations with the pharmacy vendors, but always information there. If you want to look at Canada Meds, you'll see, as I said, all the information on Bernie Portal. on that. Any questions on your health insurance? Pretty cut and dry. Yes, sir. Well, if you were following the news recently, Trump has been touting that he has struck a deal with the pharmaceutical companies that no longer will the U.S. pay higher prices than the rest of the world. So that has been done behind the scenes. He's done a lot with Medicare. He changed the drug out of pocket to the 2200. He did that 2 years ago. So if you were on Medicare, what you were paying in drugs for that donut hole substantially came down. It was cut even less than half of what it used to be. He added the Trump RX until he got this legislation passed. Now, supposedly, we should be seeing these discounts on pricing. I have some drugs, believe it or not, that are running $25,000 a month. And we have some people using those. I mean, you figure that out, $25,000 a month for one prescription. That's a lot of claim dollars and a lot of premium dollars that are being spent. Excuse me. So any other questions on I won't belabor your plan design because nothing changed in terms of your office copays, things like that. We were able to keep all of that the same, which is great news. The handout for the brand and specialty drug, the policy is in there, so you'll be able to actually see that. Again, disregard where it talks about the deductible because Highmark could not handle that with the debit card. So the $250, $500 deductible is gone. There is no need for a claim form with Highmark on the brand and specialty because you have the RX card, the debit card. If for some reason you ever pay for a prescription that's brand or specialty, we do have the claim form. It is listed on Bernie Portal for you to submit to get that reimbursement for the brand or specialty cost that you didn't run through the debit card, or you can contact us at Millennium and we'll assist you with that. There's a couple other forms in here. A benefit waive form, if you are waiving coverage for any reason, whether it be medical, dental, or vision, please complete that and get it back to us. Your premium election form, we gave you a copy of this. The only thing that went up slightly is dental. And when I say slightly, I mean slightly. For employee-only dental, I think it went up 25 cents per payroll deduction, which is twice a month. So it was a very, very small increase. That was the only increase in your contributions were dental. Vision did not go up at all. Your dental insurance remains with Sun Life. We moved it to Sun Life because they actually have providers here in Charlestown, which we had none with Highmark. So it seems to be working well for everybody. Nothing has changed there. Everything remains the same. The schedule is in there. You have $1,500 per person per year to spend in dental. If you only see preventative, you have no deductible. If you have something major done, you have a $50 deductible, $150 per family. Vision coverage has not changed. Yes, sir. I'm sorry, what was that? Yes, it is covered out of network. What you need to understand is when you get out of network, you're paying retail pricing. So they're going to reimburse it based on what their discounted prices are. So for instance, if I get a cleaning and that cleaning's $150, but Sun Life only has $100 in there, you will get reimbursed for the 100, not the 150. So yes, you still can go out of network. You'll see on this schedule of benefits where it talks about out of network, the percentages are the same in and out. Out means they're not a participating dentist. It's hard to find dentists overall anywhere in the United States that want to participate in dental insurance. Most of them are now selling their own little private dental insurance where you can go in and pay $400 a year, you get a couple cleanings and discounts. So getting dentists to participate is a bit of a struggle. But as I said, this one does have some dentists in Charlestown. So it is a better, and the out-of-network reimbursement is higher than it was with Highmark. Any other questions on dental? No. Vision coverage, again, you're remaining with NVA. You can get an exam every year. You're going to pay $10 at a participating provider. You can get lenses every year as well, and frames every year. Contact lenses once every year in lieu of lenses and frames. So it's a nice, strong vision program. Vision's relatively inexpensive. If you're somebody that wears glasses, it more than pays for itself. Yes, sir. You get an allowance up to $130, but then you get a 20% discount beyond that. So yeah. Oh, yeah. NVA won't? Well, frames out of network, they'll reimburse up to $45. So yeah, it's not a lot. But if you look with NVA, I think Warby Parker might even be on there now. So they are constantly trying to get, because they realize, like we do, it's a lot cheaper to get them that way than it is to go into some other, an eye doctor, for instance, and get them there. So check around. And if you get a receipt and they're not reimbursing it, call us. We are here to work for you and your family. Yes, I work with the county once a year, very aggressively marketing your coverages. But beyond that, we work for you and your families 365 days a year. We are your advocates. You have a problem with a prescription, a doctor, something that wasn't paid properly, something's been sent to collection, call us. We have an in at Highmark and Sun Life. NVA, we can get things handled much quicker than you can. We'll confirm everything via email to you, and anything that you say to us stays completely confidential. By law, we cannot share that with your employer, or we would lose our license to operate. We are state licensed through West Virginia, so we make a violation, they will yank our license, and we're out of business here. So when I say we work for you, we truly do. I always say a benefit's not a benefit if you don't understand it. And insurance can be extremely confusing, and nobody likes insurance, including me. It's confusing, it's hard to understand, and when you're sick, it's the last thing you want to be dealing with. So please don't ever hesitate to reach out to us and let us help you. There is a claim form in here for your medical reimbursement. You'll also see this online. Again, the only thing being reimbursed through the medical deductible reimbursement is the deductible. We're not going to reimburse for generic copays, office copays, emergency room copays, urgent care copays, only anything that's applied towards deductible. And we will only do that if you give us a copy of the explanation of benefits that Highmark sends you. We do not have access into those EOBs, they're called. Those come only to you. If you have never set up your portal with Highmark where you can download your EOBs and look at your claims, I would encourage you to do so. Highmark also offers a lot of other things, discounts on entertainment, discounts on sneakers, vitamins, massage, chiropractors. There's a wealth of things that they will give you discounts and information on, but you have to create an account there. Your medical and prescription HRAs, they run out at the end of the year, and that's important for this year too. We give you 3 months of run out. So if you're in this policy and you have something that's been applied towards that deductible beyond the $750 of your liability, you need to get that to us for reimbursement. If you wait longer than the end of October, it will be denied. You have a 3-month run out on your medical HRA reimbursement. Same thing's going to happen next year. You have a 3-month and a 3-month run out on your RX and specialty. Yes. It's a plan year. Yeah, it's a plan year. Yeah. 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 So if you've met it, it won't reset again until, yeah, the deductible resets in January. Yeah. July, I'm sorry. Yeah. Yes. I'm sorry. Yeah. Did I say calendar year? I'm sorry. Yeah. It's policy year, July 1. Yeah. Yes. Yeah. Dental is on a calendar year. Medical is on a policy year. Yeah. 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 Sherry knows. Any other questions on anything? Yes, ma'am. Correct. They're in the process. I just finished the conference call for the HRA setup. You will have them prior to July 1st. You are going to get one per family. If for some reason you need extra ones, feel free to let us know. And we can order you some. If you have, a spouse or you have a child that isn't residing with you and you need an extra card for them, just let us know and we will get you an extra debit card. Try not to lose them because getting them replaced takes a little while. So it's just like a credit card. So keep it as secure as you do any of your personal credit cards. I honestly don't know. They didn't indicate that there would be new cards because there's no change in your copays. I'm thinking the maximum out of pocket changed this year, and that trends with ACA, with Obamacare, it went up to the $10,600. And because that is listed on your ID cards, I'm going to assume that you are going to get new medical ID cards as well. Yeah, if you're not, I will certainly let Jessica know that, but I would assume that you're going to, yes. Any other questions? Yes, ma'am.
If you were to go to the pharmacy and give them the code for GoodRx, can you use the debit card that we're getting from the county?
Probably not because, the only place GoodRx really saves you a substantial amount of money might be on generics. You'll get some savings on brand, but once it goes through GoodRx, it doesn't hit insurance.
Yeah.
So because it's not going to see insurance, the debit card's not going to see it as a qualified expense.
Okay, and then you said if we went through something like Trump RX, you can use,
Yeah, if you can, it should allow you, because you need a prescription to get that. So it should allow you to put in that credit card.
okay.
This is our first time using this HRA debit card. So it may be something that things come up the first couple months that I'm going to need to be involved in. If something doesn't fly the way it should, that's when you come to us and let us know right away, and we'll work on it on our back end. Like I said, we were thinking the deductible we could have and realized we couldn't with the debit card. So unfortunately, the Highmark rep isn't here. So any other questions? Okay, I hope you walk away realizing this was a great benefit package, considering we did make some enhancements and without any price increases. We are going to list on Bernie Portal the COBRA rates. If you ever take a look at what the rate is, if you grab my folder there, just to give you a general idea, the purple one, yeah. You can see on your payroll deduction form what you are paying bi-monthly, double that. If you had employee-only coverage, that COBRA rate is about $1,200 a month for single coverage. So if you ever left here and wanted to keep your coverage, that's what it would cost you for employee single coverage, $1,200 a month. For family, it's almost $3,000 a month. So for us to stand up here and say there's been no increase in your deductible, no substantial increases in your copays, and your contributions remain the same is a lot. It really is a lot. And only when you go and start looking at what prices are in the marketplace do you understand the real cost of insurance. All right. As Jessica said, we brought Pellman products. There's coconut cake, carrot cake, chocolate cake, cheesecake, all kinds of things out there. Please take a piece with you. If you have any, yes, sir. Thank you.
I myself am very happy in that regard.
Thank you.
Tough
We
luck
work
enough.
really hard. We've been with the county now, I think right around 12, 13 years, and we work very hard at trying to control costs and still give you a great benefit package, but more importantly, being there to walk beside you every step of the way, because things don't always go perfect. I wish I could control everything, but I can't. So there will be issues that come up, but we are there to resolve them as quickly as possible. Sue Martin and Seth Braceland in our office are always available. Sue handles all the HRA reimbursements, and the county turns them around very, very quickly. So again, thank you. I appreciate that. If you have anything that you'd like to discuss confidentially, we are up here. We'll be happy to take any confidential questions. And with that being said, thank you. We wish you a very healthy and happy policy year 2027. We're done.
Just a couple things before you leave. Make sure that you've signed the sign-in sheet that was at the beginning. Again, if you'd like to take some cake, please feel free to do so. I think Lori and Tom will be here for about another 45 minutes or so. If you do have questions, please ask them. Thank you.
Jessica, what do they sign if they're not changing?
I sent an email last week. There was